as you can tell, we have Sarah Henthorn with us. She's coming from the United Way of Treasure Valley. She is a community schools lead coach and has been doing that over 6 years as a community school coordinator. So she's really excited about collaboration and supporting schools in Idaho. So we'll turn the time over to her to share a little bit about her initiatives and the things that she's been involved with. And I believe at the end we'll have some time for questions as well as a little recap as in little breakout rooms of what we've learned. So I'll turn the time over to Sarah.
Thank you so much. Let me get up and run in here real quick. There we go. All right. Well, thank you guys so much for having me. I appreciate being here because I just love community schools and I love any opportunity I get to talk about them. So we're going to nerd out together a little bit, but this is really going to be a big overview. And then you're welcome to continue the conversation. I'd love to keep talking at some other time. So our agenda for today is to kind of give you some context, why United Way of Treasure Valley is involved with community schools, what is a community school, kind of what strategies are going on in that space. And then we'll have some just brief examples of health partnerships that are going on in community schools around Idaho. And then we'll have some time for a Q&A. One thing we like to say about community schools is that if you've seen one, right? So this will not give you an in-depth context of what's happening at your nearest community school, but we'll kind of give you the overview for today. So a brief explanation of how United Way got into community schools. United Way of Treasure Valley is very deeply invested in data-driven decision making to make impact in our community. And so our community needs assessments are a very beloved part of what we do. And in 2009, the community needs assessment had some concerning data that led us to an education focus. We found that students across the state of Idaho were falling behind their peers nationally. We found that one of the lowest performing districts was right here in our region. We serve 10 counties in the Treasure Valley area. And as we dug into that data and conversations with teachers in those schools, we were finding that teachers and districts were seeing that poverty, food insecurity, violence, and a variety of other challenges were really affecting students' ability to learn. So in response to that, United Way launched what we called the P16 project to support children from early learning stages through post-secondary pathways. And we saw a really positive impact pretty immediately. And that success led us to kind of dig into strategies more. So we began studying communities that were leading the way in collective impact and particularly within schools. And that led us to take a group of United Way staff and some staff from Boise School District to the United Way of Salt Lake, which at the time was considered a national model in collective impact. And they also had the community school strategy going on there. That trip went really well. Everybody came back really excited. Boise School District decided to launch community schools at 3 of their elementary schools. They saw pretty immediate impact, and United Way stepped up to fund a coordinator position in Caldwell, and later added community schools really as a pillar of our community investment process. And then as things continued to prove to be impactful, we got additional funders and could scale even further, starting the Idaho Coalition for Community Schools, which has really been a place where we're advocating for community schools with legislative representatives. We're advocating with community partners, and we're providing support and professional development for community school coordinators across the state. And then all that has led us to a point where we were really well positioned to apply for a grant from the US Department of Ed that's called the Full Service Community Schools Grant, which is a scaling grant that is really focused on scaling the community school strategy in 50 rural schools across the state of Idaho. So in 2023, we were awarded $46 million from them to it like really invest in community schools across the state and expand the strategy statewide. So we are in year 2 of implementation for a 5-year grant. We've got 47 schools currently across the state that are implementing the community school strategy. So, as you guys are all aware, when kids are coming to school, they're bringing a variety of concerns with them. And it is really difficult to go to math class and be able to concentrate if you've got a toothache or if you're worried about where you're going to sleep that night. We also know that educators are not, while we care deeply about every issue affecting our students, we're not equipped to handle all of those barriers to education on our own. So what do? The community school model recognizes that every community has unique challenges. Every kid is facing unique challenges, but that our communities also have resilience and strengths and creativity that they can bring to the table. And that if we bring together families, students, our staff, and community partners to dig down and identify what our actual needs are, together we can come up with creative and strategic ways to meet those needs in a way that allows every kid to thrive. So community schools are just public schools that are implementing community school strategy. There's no difference between them. It's nothing special. It's not a charter school. It's a school that is deeply embedded in this collective impact model. So this is called the Essential Frameworks for Community Schools. This is kind of the leading cutting edge research boiled down into one graphic that tells us what a mature community school that's causing transformation in their community is made up of. So obviously at the very heart of everything we do is that we are trying to help students and families thrive. Obviously, we can't do it alone. So the people that are driving the work are community partners, our school staff, including most schools call them coordinators. I know West Ada calls them community school liaisons, but some dedicated staff member who's really focused on this work, and then incorporating the wisdom and resilience that our youth and families have to offer. Enabling conditions really are important to this. We need actionable data because we know that the root causes of our problems are going to differ from location to location. So nationally, you will hear every school says attendance is an issue, right? What we don't often realize is that in one neighborhood, kids are staying home on days that their parents can't drop them off because there's a busy road that they have to cross and parents are afraid that their kid's going to get hurt, and so they keep them home, right? In that community, having a crosswalk and a crossing guard or a new bus route might fix the issue. Whereas in a different community, maybe kids are staying home because there's no safe and affordable childcare. All the parents have to work at the plant and it starts an hour and a half before school starts. And so all the kiddos are staying home to watch younger siblings, right? So there's very different strategies that are going to impact this, what seems like the same issue on the surface. So every school has to do an assets and needs assessment. Every school has to have inclusive decision-making and a shared vision and trusting relationships. And really that comes down to every school has every community school that is mature and leaning into the full picture of what it's supposed to be has an advisory council that is made up of community partners, parents, and staff members. And depending on the age group, includes student voice as well to come together, look at the data, say what are our most pressing needs and how are we going to choose to address that. So the advisory committee is a great place for partners to kind of start interacting with community school work. Then this lighter blue area are key practices. These are things that, depending on the needs, you may see one or two, you might see all of them in a community school that's been around for a while. These are the different practices that set community schools apart. But I will say that any school is going to have some of these, right? It's just that these are things that a community school is actively looking at and integrating into their strategic plan. I just want to highlight integrated systems of support on this one is often where health related partnerships are going to fall. It's where we're looking at barriers to learning and trying to meet needs so that students who might be disadvantaged when they're entering the door, students who are carrying all that extra baggage, that as much as possible, we can remove some of that baggage so that they can focus on learning. And then as community schools mature, this outer area is basically that we're building systems that allow the work to continue, right? That we're working towards continuous improvement and that we're continually gathering data and pivoting based on who our students are. When you think about it, say middle school, your entire population's changing every 3 years, right? So if your data is 3 years old, it's not even relevant anymore. So how do we build in to our culture that we're continuing to have conversations and partnerships so that we are able to help students that we have now, not the students we had 3 years ago. So we're going to take a minute here and just share a really cool video that's going to highlight one of our schools in Rigby and one in Cascade and how they are implementing community schools and how it's been transformative for them.
So many students across our state have unmet needs, and there are barriers to their academic success. Community school strategy absolutely provides the path and opportunity for schools to have a more comprehensive way to meet those needs. The Blue Cross of Idaho Foundation for Health has been an integral partner in working with the Idaho Coalition for Community Schools, and we've come in as a funder that is allowing for the lift of community school strategy out of the Treasure Valley and into all regions of Idaho.
I feel like a community school opens up the dialogue between the schools and the families and lets families know that we are here to help.
We do an annual needs assessment and we survey the parents and kids in our school to try to determine what they think they need and what they value out of education. The goal of a community school is to figure out what needs the community has and what desires they have. So our job as a community school is to actively seek for those community partnerships and bring in those services and resources to be able to help kids.
We basically are the hub. The services are brought to the hub to provide for our families and our students.
The very first needs assessment that we did, there were almost half of the respondents who answered to an open-ended question, what do we wish the community had? People wanted after-school programs, or they wanted a safe place for kids to be after school, or they wanted a community rec center.
The after-school program is amazing. I wish that every school could participate in it. It gives all the students here an opportunity to grow in ways outside of just their education.
In the state and in the nation, there's a major mental health crisis. Our kids are suffering and struggling at a rate that I don't think we've seen before. If you look at the research, anxiety and depression among our youth is skyrocketing. And One big thing that we did with Blue Cross of Idaho Foundation this last year is we partnered with them to do the Healthy Minds Partnership. And that was a program that gave us technical assistance to navigate the waters of getting mental health clinicians into the schools.
Our school also does the recess program where they have specific things set up for the kids to participate in, so no kids feel left out. There's always somewhere that they can go, something that they can play, something that they can do and be included.
The recess zones help our kids create trusting relationships with each other, trusting relationships with the adults on the playground.
According to the state's metric on school success, our school has gone up by over 108 points in the last 5 years. So I think that that's a great benchmark that shows some of the good things that we're doing as well.
I wish that every school had a community school because it helps to meet the basic needs of the students first so that they have food, so that they're more prepared and able to learn. It helps to meet their emotional needs. It helps them learn how to better work with other students. There's not enough good things I could say.
You'll hear a phrase about community schools. If you've seen one community school, you've seen one community school. And that is because every community school is unique, not only to their community, but their neighborhood. So the uniqueness that you will see at Harwood Elementary is going to be very different from what you see at Cascade School District.
Once we got introduced to the community schools strategy, I really started to realize that being in a small school, we are the heart of the community, and oftentimes the place where people come, families come, kids come when they need something.
Cascade School District had some key components for community school strategy. They have an amazing preschool program. They also have some really great out-of-school and after-school activities. Where they are now in the formal linking of all of those program supports is actually creating a stronger, more comprehensive system.
I think so many times in education these days we feel like we're just adding one more thing and one more thing, and this isn't one more thing, it's like the thing.
For me, one of the things that I'm most proud of is this teen center. It interacts so well with community schools because, first of all, we're in the school, which is the immediate perfect fit where the kids are already here. It's really easy for them to come in. But it additionally offers something to the school, which allows them to continue to connect with teens and families after normal school hours and kind of helps us break down those walls like, well, it's 3:45, I'm done with your kid.
We have also started a journey with the Healthy Minds Partnership to bring in a licensed clinical social worker to work with some of our students and families that are needing that support and wanting access that's more friendly for them.
To me, the community school model is just all of these different little mechanisms that feed perfectly into community schools that provide for the whole health of the child and the family unit.
Academic outcomes have improved greatly. We've gone from an underperforming school in the state of Idaho to one of the top growing schools in Idaho. We hit the top 10 math proficiency for a district, so we went bottom 5% to top 10% in 5 years by focusing on systems that are sustainable and holding high expectations. Like our current kindergarten class just finished their early literacy state assessment, and they came out at 87% proficient, which means like all but one or two are reading right where they need to, which has not been the case for us. And I think that has a lot to do with early childhood programming that we offer, because those kids that leave there are ready for kindergarten.
The positive impacts of community school strategy really go back to the increase in student and family engagement, increases in academic success, the ways to address chronic absenteeism. It's important to recognize that all of the factors that schools are measured on, by which they are identified to succeed, are impacted by community school strategy.
I think kids are so much more than a number. And I think it's important that as a community, we know our kids. We know what our kids need. We know what their families need. We don't just push them through. We get to know them, we love them, and we help them. It's a community responsibility to raise good kids.
If students aren't successful in their academics and they don't have great academic outcomes, that leads to poorer health outcomes for them in the long run. So that's why our investments as a health foundation are critical.
Without the coalition and the Blue Cross of Idaho Foundation, I don't think Cascade would be where it's at and moving in the direction that it is. Without that mindset and without even some of the training and some of the things that we've already gone to and kind of been a part of, you don't necessarily understand how that all fits together.
The Blue Cross of Idaho Foundation for Health has chosen to invest in community school strategy because we recognize and believe that the work we're doing truly will create better health outcomes for the students, the families, and the communities where we're supporting community school strategy. When students and families succeed, communities succeed, and when communities succeed, we all succeed.
All right. Love that video. And yet, we're moving on. So here is a map of, these are districts that have community schools in one or more schools within their district. So we have community schools represented in every one of the educational regions across the state, which is great. And hopefully next year we'll have even more. So I wanted to give you guys just a couple snapshots of what some health-related, sorry about that, some health-related interventions and supports that we're seeing at individual community schools. So this example is actually one that's spreading across the state, and that is to have outside counselors come in and be co-located within the school. For some of our schools, it's 1 day a week. Some have higher levels of need and have multiple days a week where mental health professionals are coming in and seeing kids on site. And we're seeing some great success with that across the state. Another story is in this district, they worked really hard to do vision screenings every year. And then they would notice, they would let parents know that kids needed to be seen and nothing would happen. And as they dug into it, it was really difficult for some parents to afford. And it was also difficult for them to access an optometrist because it was a ways away. And so they brought 3 different partners together, one partner to do the screening, one partner who was willing to issue vouchers for a free eye exam and a pair of glasses, and an optometrist who was willing to see kids and accept the voucher, right? And so they had 13 students who failed their vision screening at school. Same day, were able to contact parents, give them a voucher, and set them up with an appointment with an optometrist. And every student ended up being able to get what they needed and saw real improvement in their learning experience from that. So these are kinds of the creative ways that schools are trying to rally communities to meet the needs that they're seeing in their school. Some trends as far as identified needs. Multiple schools across the state are seeing mental health and behavioral needs. They're seeing it identified by students. They're seeing it identified by staff. They're seeing it identified when they're talking with caregivers. And this is not only a need that the students have, but all people in the community have. We're seeing attendance being identified as a major concern, and depending on where, which community it is dealing with that issue, there are some medical provider deserts, right, that may be part of the issues that they're seeing with attendance. Another one being safe before and after school care and enrichment opportunities. And so there's a lot of strategies that we're seeing that are going into life skills and healthy living as sort of an extracurricular conversation, right? So if you have educational programming, it's a good fit for the schools that are looking for enrichment opportunities. Some trends that we're seeing in supports. Again, each community is different, but a lot of community schools are going to have access to basic needs pantries. These are often supported by donations. So on any given day, they may or may not have what a specific student's looking for. But most of the community schools are trying to provide access to food and clothing and school supplies for children in need. A lot of schools are finding reason to partner with mobile health clinics and any on-site services. One of our Parma Middle School just was working really closely with Terry Riley's mobile unit, and we're making sure that it was full every time it was out there. And that led to a proof of sustainability. And so Terry Riley began working with them and negotiating with the city, and they're looking at potentially having a brick and mortar on-site clinic over there. So that's really exciting that community schools can work with providers to prove whether or not there's enough need to sustain long-term solutions. And then obviously, again, mental health professionals in schools is something that all the schools are kind of clamoring for, especially in the rural areas. Part of that is because with we're finding that many kids have to travel so far to access a provider that parents are at risk of losing work, right? Because they have to take off work, pick their kiddo up, travel an hour, have an hour for the session, come back for an hour. And so kids are missing significant time in the classroom, and parents are missing significant time to get them to the services that they need. And so having mental health professionals available in the schools is really impacting families' ability to just sustain access for their kiddos, which is encouraging. We do a monthly newsletter that highlights practices that are going on in community schools. So if you are interested in that, you can go ahead and use the QR code. But that really brings us to our question and answer time. I know I went through it really quickly, gave you kind of this major aerial overview. So if you have questions about a specific community school, the best way to get involved is to call their community school coordinator. In West Ada, it would be a community school liaison. But all that being said, are there questions that I can help with? All right. Well, thank you guys for letting. Oh, go ahead.
I was gonna ask something. I know I've been messaging a lot of you directly to see how you interface with community schools, because I find this work to be really fascinating. And when I was able to tour my first community school in American Falls, I was blown away by the co-location of services and the ability to like have a behavioral health room that could increase access to a mental health provider, and at the same time get dental care, food. Parents could there's places to hang out, like the after school program, and like shown in the video, and places for parents to engage in adult education. It was just really awesome to see. And I, I'm thinking, Sarah, I probably should reach out to Jackie and someone else at United Way, because as I look at the Rural Health Transformation Fund, and a lot of the provisions in there about like increasing mobile clinics, or funding for mobile clinics, funding for behavioral health pods to be created. I'm just thinking like community schools would be so well placed to take advantage of some of that funding to rural areas that will be coming over the next 4 or 5 years. Any thoughts on that? I
think, yeah, it's a great idea, and the schools that are able to do it are really thriving, and we're seeing great impact data that I am hopeful we can share to convince others, right? I think every school, the interesting piece is that within a given school, the coordinator has different levels of power, right? And so there are some things that would have to be negotiated with the school board or with a superintendent. I think we see a lot more openness in the more rural locations as far as how long it takes to implement a partnership. But our community school coordinators are absolutely the ones who would be able to coordinate, like, what's the schedule? How do we get the right kids in the right spaces, and make sure that when you come, that every kid who has a need is being ready to be seen. Yeah, and American Falls is amazing. They're doing some really great things. One of the things, like, them and Marsing both have unique models in that they had the space, right? So some schools are bursting at the seams and really don't have that space to negotiate, which makes the mobile units really helpful. And then other schools have like all these extra spaces, and they're like, hey, if you will come provide services for our kids, we'll commit this space, this office space will be for you, right? And so the great thing about the model and the most frustrating thing about the model is how adaptive it is, right? So I can't tell you, like, call the coordinator, you're in at 50 schools across the state with one phone call, right? But it's certainly worth exploring.
Great. I have another question, but if anyone else has one, go for it first.
I was just going to point out Susie's comment about American Falls and their community school there, about her visit to the central office and seeing like the health clinic, the co-affiliations, and food bank there. So it's cool. Glad you were able to see that, Susie. Go ahead, Ryan.
Yeah. Well, I was going to say, so our community health workers are great advocates for their communities. If they don't have a community school, I'm sure that they would want one. How does a community member or a community health worker advocate for a community school for their community?
Yeah, it's a good question. It kind of depends on your relationships. I think the first thing is to start building relationships with your district leaders, right? And to help them, like, encourage them to maybe go tour other community schools. Like, hey, next time you're in American Falls, stop by and see the cool things they're doing. I think it could be really helpful. Sharing data that you have about the needs you're seeing in the kids that they're serving can be helpful to start conversations. I think the hard part, as in any other field, the hard part is always like, where's the money coming from, right? And so if you get to a point where school leaders and district leaders are at the point where they're like, we're sold on the idea, but how do we even manage starting that up? I would say get them in touch with us at United Way of Treasure Valley. We aren't actively, on our grant, we're not taking on new grantees right now, but we do have lots of resources and information for how other districts are funding the coordinator role, which is really the startup cost, is funding a coordinator who's dedicated to all of this, right? And so that's kind of where we would start the conversation. We also have professional development available for schools that are looking into it.
So without funding to expand right now it really is like a grassroots. Communities have to kind of come to you to get the resources, the startup not necessarily monetary resources, but like the know-how, the education on the model, and then make sure they have the buy-in and the support in their district offices and their communities. Would you say that's accurate?
we are not the only source of information, right? There's community schools have been around nationally for 65 years, even though around in Idaho, they've been around for like 9, right? And so there are lots of resources that way. It's just we are very connected with the people in the state who are doing the work and can find them models that feel appropriate, right? So Boise funds their coordinators based on foundation funding, but there are other districts that don't have foundations, right? So we can put them in touch with, one school is using title funding, right? And so we can put them in touch with the people who tell them, like, how is this justifiable with federal funds? What grants are other people using to staff and things like that? And then we are currently doing research with our grant cohort to be able to advocate better on the return on investment. So we're hoping at the end of our 5 years to say, on average, for every dollar you put into a coordinator salary, you're getting, nationally, it seems between $7 and $15 return on investment from the resources they're bringing in for your students and families. And so we're hoping to have data that we can use to advocate for the state to take on some of that cost.
I see that Susie asked if Cascia or Burley has been approached. Do you know of any efforts to establish a community school there?
I don't. That's not my region, though. So it's possible that they have been working towards that, and just that I'm just not aware of it.
How does the community schools engage with like Head Start programs? And I know the Head Start program funding has also been threatened recently. So just curious to know.
Yeah, Head Start, their numbers are federally set. And so when I was a coordinator, Head Start was something I was interested in. And even if I was able to co-locate them at the school, it wouldn't have opened up extra seats. It just would have meant less time on the bus, right? For our students. They have a set amount of students that they're reaching. So a lot of our community schools that are that have a focus on early childhood education are working with other partners to kind of support the kids who maybe are in that gap between the ones that qualify for Head Start and kind of the high performing upper middle class families that don't need the extra support, right? And so we see a lot of people working with Idaho's Association for the Education of Young Children to bring in kindergarten readiness programming. Homedale has started their own preschool because there's no preschools in town that are available. And then they're trying to keep the costs relatively low and scholarship families who are in need. So we're seeing a variety of strategies around that. I haven't seen anybody directly working with Head Start as far as like co-locations or anything, just because it does. There's a lot of regulation on the building metrics that they have to meet, and to put all that money in and not get extra seats, right, is kind of a disincentive for the schools to put their focus there.
Any other questions from the group? You mentioned partnerships with Terry Riley, and I think it was Anna said that the St. Luke's has a pediatric mobile unit that's been active. Sounds like in Mountain Home. I know in American Falls, I believe it's ICU Bengal Pharmacy, but I'm not exactly sure on that, if I have that in my memory right. But so we have these, and I'm pretty sure that Family Health Services has a mobile clinic or has some outreach to schools in the Twin Falls area. So these are examples of community health centers or clinics partnering with community schools. Are there other And I think they're mostly, I mean, they're both mobile units, and also for those that have space, they've created like these clinics on site even. So, are there other models beyond those, or examples of clinic or community health center school partnerships that you're aware of?
So, West Status partnership was with Full Circle Health, and then that went away. But they had one school that had a clinic on site in a portable, both dental and medical, and then would bus kids in need from the surrounding schools, so from other schools within the district. And then any person within the district, any student could get medical services there. I think with changes in leadership, that partnership is faded. I think they're moving towards virtual medical access. We've got several outlying areas for mental health services that just are having providers co-locate within the school, which is great. Yes, and Delta Dental in particular is working with a lot of schools, and then the health districts, depending on what they offer, that's mobile, are partnering with schools. Often that just is looking more like screenings, immunization clinics, a lot of drug prevention and cessation programs that are tailored towards that age group. So there's a variety of health-related initiatives that are happening in schools.
I don't want to leave out CHAS too. You also mentioned CHAS earlier in your presentation. So yeah, those are great. There's all throughout the state examples of how schools are making this work to better serve kiddos in those schools. So thank you. I don't have any other questions. I obviously had a lot. I'm sure I have more if you give me a couple minutes, but
it's always fun to hear Ryan's questions because he obviously is really interested in what you're doing. I love it. Thanks, Sarah.